Hi, I'm Dr. Nadia Binti Hatta. I am from the Preclinical Sciences Department of Faculty of Medicine and Health Sciences, UTAR. I have been teaching with UTAR for the past 10 years. For the past 2 years, we have done online distance learning. This came with its own challenges. We needed to adapt rather quickly. And I felt that the most challenging part of online distant learning was conducting the exams, because we had to make sure that all the invigilation process was observed well, and to make sure that all the students comply with the rules even though they were doing exams from their own homes. Of course, the drawbacks were the fact that we cannot be able to interact with the students face to face. We're not able to see how they are reacting to certain things directly, and therefore we're not able to assess whether or not they're being confused. We can't see their body language and also their non-verbal communication, because non-verbal communication is just as important when it comes to teaching. So I felt that those were the drawbacks. It also opened our eyes to how effective online learning can be, because there were certain courses, like for example, I was handling the laboratory medicine course. I personally felt that the students benefited more from an online learning way compared to the in-person mode, because when it was in the in-person mode, the students had to go to laboratories in groups, and some may not be able to see certain things as clearly as they should, whereas during the online mode, everything was presented to them via a screen and everybody got to see it rather upfront and up close. So I felt that this was more effective for the students. But all in all, I feel like the advantages were more than the disadvantages. Personally, like I said, it definitely opened up new frontiers. Mental health is our emotional, psychological, and social well-being. A lot of people often miss out on the social part because it very much contributes to our emotional and psychological well-being as well. A lot of people think that depression is normal sadness, but actually depression is an abnormal state of sadness where you feel symptoms of discouragement, sadness, helplessness, hopelessness. There may also be anger and lack of motivation or interest in life in general. Now, this is very important. This is also known as anhedonia, which means the loss of interest in doing pleasurable activities. What normally would lift your spirits up or would make you happy no longer holds any interest in a person who is going through depression. You will also have low energy level. You may feel that your sleep cycle is disturbed. Either you're sleeping too much or you're practically not sleeping at all. And there is also a feeling of overwhelmed by daily tasks. You feel as though even the smallest task needs a huge amount of energy to perform. So this is depression. So for anxiety, whenever somebody has an anxiety disorder, that person may experience fear, panic, or anxiety in situations where most people do not feel anxious. So this is something that we need to bear in mind. Anxiety is an abnormal state of worry. It is not something that we feel normally. And there is a constant nagging worry or anxiousness. And there may also be sudden panic or anxiety attacks without any clear trigger. So this is anxiety. Stress and anxiety seem similar, but actually stress is your response to daily pressures, whereas anxiety is actually a reaction to the stress. Now, stress may sometimes present with physiological symptoms such as headaches, high blood pressure, chest pain, heart palpitations, sometimes even skin rashes, and also loss of sleep. So these are the things that you need to be aware of whenever we talk about depression, anxiety, and also stress. I feel that mental health is definitely something very, very important and needs to be paid attention to, because in the past 2 years, while going through the pandemic and adapting to a new system, a lot of us are quite unaware of what our colleagues are going through because we are all isolated in our own places. The attention is normally focused on students, and there is also this burden on lecturers whereby they need to keep the course going and they need to keep the things moving, and there is actually no time for breaks. This would actually pose a certain expectation on the lecturers where they need to go on regardless of whether or not they have their own personal issues at home or whether they are handling things well in a more wholesome manner. A lot of us may not entirely be aware that even we ourselves are going through some form of mental health deterioration, because the need to continue on with our jobs sometimes surpass the needs of looking into our own mental health or into our own social well-being. Sometimes we do not realize, or rather we take for granted, that going to work and isolating the workplace from the home is actually a very, very important step in maintaining our mental health. This is something that we have only started realizing during the pandemic, where our workplace has somehow melted into our home space, and this created a lot of anxiety among the academic staff. The awareness of mental health has somewhat improved here in Malaysia, and the culture has also improved in the sense that we are more aware of it and we are more ready to talk about it. There is some stigma surrounding it still, but I feel as though there is not so much stigma as there is lack of awareness. So a lot of people feel as though if it is not a physical health problem, it is something that is not looked at more seriously. In terms of awareness, we are getting there, but it can of course be very much improved. I feel, especially since we are in the Faculty of Medicine and Health Sciences, feel that the awareness should be more among us compared to the other faculties. I think it is good currently because we keep checking up on each other. If anybody were to take a break, there is not going to be a lot of back and forth. I think everybody pretty much understands what each other are going through. We do have a lot of webinars and online forums regarding mental health. The counseling unit in UTAR, I feel, is very, very active and is very, very much involved. I've attended several of the seminars myself, and I feel that they provided a very useful information. They are always ever ready to help out if we need somebody to talk to. There is a bit of anxiety, I would have to say, going back to hybrid mode or going back to physical teaching. Anxiety in terms of whether or not it is entirely safe right now, particularly with the Omicron variant. But we have declared it an endemic, therefore we have to learn to live with it rather than keep avoiding it. Personally, I feel, like I've said before, I feel like the online teaching has proven to be beneficial in certain courses. And I feel like some classes should be maintained online, not just lectures, but a lot of the classes I feel can benefit more from online learning because the students can be able to see things clearly, especially when it comes to subjects like pathology, where things needed to be seen on a screen better. So I think these are the things that should be considered. A lot of the decisions were made top-down, so I feel like we can contribute our suggestions. I think that the staff needs to be heard more by the higher authorities in terms of the suitability of certain courses and certain classes. The lecturer's opinion need to be taken more into consideration if they were to suggest that certain classes are more suitable online compared to face-to-face learning. On a personal level, I feel like my colleagues have provided a very, very strong social support. I feel like I can talk to them whenever I need help, and they're always ready to extend a helping hand whenever I feel a little too overwhelmed with the task that I've been given. So on a personal level, I feel that there is no problem. I think that it is very, very important for us to always keep checking on each other and making sure that everybody is doing well. I feel that if we are more aware of these things and if we acknowledge it, then it would be better. Everybody would be more willing to share the hardship that they go through rather than keep it to themselves, and then after keeping it bottling up for a while, let it blow, and it will not be good for everybody if that were to happen. So it's good for us to every once in a while talk about it and be comfortable enough around our colleagues to actually vent out. Identifying possible red flags may prove to be a little difficult this time around because we have not entirely returned to office yet. We are always highly dependent on what each other are telling each other. Basically, if somebody does not open up, it is quite difficult for us to actually detect that something is wrong. So I do encourage people to talk about it. And on a personal level, whenever I see or whenever I detect that somebody may be too overwhelmed with work or too overwhelmed with tasks, I always reach out to them either via WhatsApp or via Teams or via email. Another red flag that I noticed that if anybody is being overly apologetic about something, like they feel as though they are at fault for something not running smoothly, I feel that it is very, very important for the colleagues to say that they're doing a great job, they're doing well, and if they need any help, please reach out. It takes off a huge amount of burden of people's shoulders, and I think more and more people should do this so that everyone feels well supported. On an employer level, I feel that there is enough leadership modeling within the faculty itself. Although I feel that from a higher level, things can be improved in terms of listening to what the lecturers have to say in terms of how to run their specific courses. I think this would be very, very much helpful. We are on the right track, definitely, and to keep supporting each other in times of crisis is very, very vital and important.